Unconscious in 15-year-old found on the street diagnostics, ABC, airway, breathing, sexual agent disability, distress, environment, hypothermia, and check all vital signs. Check for sign of any trauma, treat as needed, stop bleeding, etc. In no respiratory effort or in cardiac arrest or spear, same as on or others, chest compression at 100 or 120 per minute, 5 to 6 centimeters, and for defibrillator, assess rhythm, call ambulance, vascular assess, couple rhythm, epinephrine in IV, 10 mcg per kilogram, amiodarone IV, 5 milligram per kilogram every 3 to 5 minutes after third shock. Non-shockable, give epinephrine 10 mcg per kilogram as soon as possible. Treat for 8 and 14. Hypovolemia, hypothermia, hypoglycemia, and hypokalemia, causemia, magnesemia, toxin, tension, pneumothorax, tamponade, thrombosis, considered drug overdose, either recreational or with a suicidal intent, as teenagers are prone to overdosing. Also, alcohol intoxication. They have to do a CT upon arriving to the hospital to assess internal bleeding. Vital sign, heart rate, respiration rate, and temperature assessed for airway obstruction. ECG, EP studies later when stable to assess for life-threatening conditions like HCM, CDC, and electrolyte for signs of infection or electrolyte imbalance. Tox, screen for commonly abused drugs, and CT, assess for any head injury, ruptured AMI when a 15-year-old is found unconscious on the street. A systematic and comprehensive approach is essential for diagnosis. The approach to such a patient should be rapid and prioritize stabilization of vital signs while considering a broad differential diagnosis. The cause of unconsciousness may diverse, encompassing traumatic, medical, and toxicological etiology, characteristics, symptoms, and pathophysiology, symptoms unresponsive to verbal or physical stimuli, potential signs of trauma, altered breathing patterns, or signs of substance use. Pathophysiology, the underlying cause could range from acute traumatic injuries, head injury, head trauma to medical conditions like hypoglycemia, seizure, or intoxication, poisoning. Clinical presentation and diagnosis, primary survey, ABCs, initial immediate assessment of airway, breathing, and circulation is crucial, followed by disability, urological status, and exposure, complete examination while maintaining temperature. History, gathering information from witness, friends, or emergency medical personnel about the circumstances found, any known medical history or possible substance use. Physical examination, look for sign of trauma, odor of substance, needle marks, or any medical alert tag. Neurological examination to assess the Glasgow Coma Scale (GCS) score. Laboratory test, blood glucose, medieval bedside glucose test to rule hypoglycemia. Toxicology screen to detect the presence of drug and alcohol. Complete blood count, CBC, electrolyte functional liver injury to identify metabolic disturbances. After blood gas, ABG to assess the acid for acid-based disorders. Imaging CT scan of the head rule out intracranial injury or hemorrhage, cervical spine, X-ray or CT if trauma is suspected or cannot be ruled out. Further assessment, depending on the initial findings, further assessment like MRI, EEG for seizure activity or lumbar puncture, if infection of the central nervous system is suspected, might be warranted. Treatment, immediate management, sterilization of ABCA administration of IV glucose if hypoglycemic, naloxone for suspected opioid overdose, and thiamine in cases of suspected alcohol-related encephalopathy. Specific treatment depending on the underlying cause, such as anti-epileptic drugs for seizure, antidotes for specific toxin, or surgical intervention for traumatic injuries. Prognosis is highly variable, dependent on the underlying cause of unconsciousness and timeline of intervention. Differential diagnosis table, trauma, brain injury, signs of head injury, confusion or memory loss, drug overdose, pinpoint pustules, opioid or dilated pupil, stimulant, history of substance use, metabolic disorder, hypoglycemia, hyperglycemia, electrolyte imbalances, neurological conditions, seizure activity, sign of stroke, physiological conditions, history of psychiatric illness, possible drug use, high yield points, immediate prioritization of airway, breathing and circulation in an unconscious patient. Comprehensive assessment, including history from witness, physical examination, and targeted diagnostic tests to uncover the underlying cause. Early and appropriate management based on identified cause is critical for the patient's recovery and outcome. The approach to unconscious adolescent found on the street requires a multidisciplinary and thorough diagnostic process to promptly identify and treat the underlying cause. Okay, so let's sum up. Unconsciousness 15-year-old found on the street, diagnostic ABCDE, airway, breathing, circulation, disability, GCS, environment, hypo and hyperthermia, trip, the or viral signs, check for signs of any trauma, treat as needy, stop bleeding, etc. In no respiratory effort or in cardiac arrest, TERS, PR same in on others, chest compression at 100 to 120 minutes, 5 to 6 centimeters, and for defibrillator, assess rhythm, called ambulance, vascular assess, shock over rhythm, epinephrine, IV, 10 mcg per kilogram, amiodarone IV, 5 milligram kilogram every 3 to 5 minutes. After third shock, non-shock cover give epinephrine 10 mcg per kilogram as soon as possible. Treat for H and for key. Hypovolemia, hypothermia, hypoglycemia, hypokalemia, parsemia, magnesemia, toxin, tension pneumothorax, tamponade, thrombosis, consider drug overdose, either recreational or with suicidal intent as teenager, are prone to overdosing. Also, intoxication may have to do CT upon arriving to the hospital, assess internal bleeding, vital sign, heart rate, respiratory rate, temperature, assess the airway obstruction, ECG, EP study later when stable to assess the life-threatening condition like HCM, lactate, electrolyte for signs of infection or electrolyte imbalance, tox screen for colony of stroke, CT assess for any head injury and object AVM. Characteristic symptoms and pathophysiology, symptoms unresponsive to work or physical stimuli, sign trauma or to the breathing, pattern sign of substance use, pathophysiology underlying cause could range from traumatic injuries, head trauma, to medical injuries. Okay. Clinical presentation, diagnosis, primary survey, ABC, historic physical examination, laboratory test, blood glucose toxicology, complete CBC, ABG, CT scan, cervical X-ray, CT. So imaging CT scan of the head, cervical spine, X-ray or CT, further assessment depending on the initial findings, further assessment like MRI, EEG, seizure activity or lumbar puncture if infection of the cranial central nervous system is suspected might be warranted. Treatment, immediate management, stabilization of ABC, administration, IV glucose if hypoglycemia, and naloxone for suspect of opioid overdose, thiamine in case of suspect alcohol-related encephalopathy. Specific treatment depending on the underlying causes such as antibiotic drugs for seizure, antidose, or specific toxin surgical intervention for traumatic injury. Prognosis highly variable depending on the underlying cause of consciousness and time of intervention. High points to immediate prioritization of airway, breathing, and circulation in an unconscious patient, comprehensive assessment including history from witnesses, physical examination, and targeted diagnostic tests to uncover the underlying cause. Early and appropriate management based on the identified cause is critical for the patient recovery and outcome.